Few technical details. Just minimize it up here. There you go. And then you can use the arrows. Alrighty. So, hello everyone. My name's Nicole. I will be starting us off today for the Spring 2026 Graduate Planning Studio. There we go. Zoom issues. Perfect. So to start us off, I would like to introduce us to our studio members. When I say your name, please just raise your hand. Ladarion, Ada, Brendan, Mercy, Maheen. We have disappeared. We are back. Brendan, we have Shreya over here. We did our studio over the course of 14 weeks. And I would like to acknowledge a few of our partners over at the American Planning Association NJ chapter, or the APA NJ, as well as Salem City. We would also like to acknowledge our academic and institutional partners, interviewees, and guest speakers from the region. So just a little presentation outline before we get into our content. I will be starting us off with the introduction. Shreya will be continuing with our methodology. I'll be back for the background. Ladarion will start us off with our analysis in environmental health. Ada with mobility transportation. Brendan with healthy food access. Mercy with healthcare access. Maheen with housing. Brandon with community economic development. We will all discuss our recommended actions, and Shreya will be rounding us off tonight. So, to begin, here's a little bit about our studio project, working towards a Salem City health element. So a health element is a component of a city or county's master plan that integrates public health into land use, zoning, and general planning practices. Through the incorporation of public data, community voices, and broader health goals. The purpose of this project is to evaluate and beta test the APA NJ's Plan for Health New Jersey toolkits within the context of Salem City, while developing research-based recommendations for incorporating health outcomes into master plan, zoning, and capital improvement programs, producing actionable, context-specific guidance that addresses Salem City's unique challenges. This project also serves as a model for future implementation of the Plan for Health New Jersey toolkits, with the hope of inspiring other New Jersey municipalities to integrate them into their own master plans, ordinances, and policies. A core aspect of our project was adapting the APA NJ toolkits into the municipal context. But first, what are these toolkits? I know you guys haven't been studying these toolkits for months on end like we have. So the APA Plan for Health New Jersey toolkits are the result of a larger collaborative effort between the APA and the American Public Health Association to promote planning for health. Sponsored by the Robert Wood Johnson Foundation, this larger initiative was created to help build local capacity, to address population health goals, promote the inclusion of health goals in non-traditional sectors like planning. The APA-NJ created the Plan for Health New Jersey toolkits under these 5 major categories to provide New Jersey decision makers with model policy and language to develop model master plan public health elements, ultimately advancing public health through land use planning. Our project has taken these toolkits and applied them to the context of Salem City. It should be noted that our team has split housing and community development into their own separate categories for this project, as Salem City had a robust amount of information for both of these respective themes. Oh, good, Mike?
Yeah, I just turned the video back.
Oh no, they lost us on Zoom. And we're back. So here we have a visualization of our timeline, starting all the way in January and working our way up to tonight's presentation. So before we dive into our findings, first we have to understand why Plan for Health in the first place and the history behind public health and urban planning. So urban planning was actually born from public health needs. In the 19th century, rapid urbanization in the US resulted in mass overcrowding, hazardous housing conditions, and increased concentrations of hazardous material. In the 1900s, these studies diverged as planners began to focus more on land use management, and medical providers focus more on clinical care. This is what's known as professional silos. Now, in the 21st century, there's been a resurgence of integration between these two fields. Effective planning is now being redefined through cross-sectoral collaboration and systemic shifts in decision-making. According to the 2022 Trenton Community Health Needs Assessment, public health agencies, including the U.S. Centers for Disease Control, or CDC, widely hold that at least 50% of a person's health profile is determined by what's known as social determinants of health, which can be seen on the screen behind me. According to the U.S. Department of Health, these are the conditions where people are born, live, work, play, age, and worship that affect a wide range of health, functioning, and quality of life outcomes and risks. In our studio, we mostly dealt with socioeconomic factors and physical environment due to limited clinical care and health behavior data. We relied mostly on qualitative data for these two aspects. So from our intensive literature review, we concluded that the social determinants of health were a critical element to be integrated within our projects. The chart behind me shows all of our project sections, the relation to the social determinants of health, and the direct public health outcomes that result. So let's take an example from one of our pathways. Let's look at lack of public health transportation. For a community with limited private transportation, this can cause social isolation, which directly influences rates of mental health disorders, rates of diabetes, obesity, and even premature mortality. Gaps in even just one of these sectors, for our example, its transportation infrastructure, can cause a detrimental domino effect on our community's public health. APA officials and planning professionals have been acknowledging this intersection more and more over the past 20 years. Here we have just a few modern planning for health documents our team has reviewed and analyzed throughout our timeline. I would like to particularly point out the Camden Health element. It has been a large inspiration for our team when it comes to the nuances of planning for health. And with that, I'm going to turn it over to Shreya to present our methodology. Shreya?
Thank you, Nicole. We began by reviewing scholarly and grey literature along with APNJ's toolkits to build a solid theoretical foundation. We then used GIS data to understand the city's socio-economic and built environment, mapping both trends and challenges. This included advanced GIS analysis to determine the percentage of the population with access to key amenities and identify areas ideal for housing and food access interventions, providing the spatial, quantitative backbone of our recommendations. We also engaged directly with the community. This included formal and intercept interviews with city officials, local employees, and residents. In partnership with the mayor's office and Ranch Hope, we organized 2 community workshops, one in person and one virtual. Additionally, all team members conducted field observations, many returning on multiple days to ground truth our findings and gain a clearer picture of the city. Our community workshops used emotional mapping, written activities, and facilitated group discussions to identify where Salem City's strengths, challenges, and opportunities were spatially located from the perspective of residents, all through a public health lens. Here, you can see a word cloud capturing the most prominent themes from our community engagement activities. The standout theme was limited food access, with the vast majority of participants highlighting how food-related challenges increase residents' risk of nutrition-related chronic illness. The 4 largest words represent the most recurring themes across all interviews and workshops, each tied to a social determinant of health. With that, I'll hand it back to Nicole to walk us through our project context.
Thank you so much, Shreya. So here we have a short timeline of Salem City's history, starting all the way back in 1675 when it was originally founded as Salem Colony. It wasn't incorporated as Salem City as we know it until 1858. In 1862, the second glass factory in the entire United States was founded right there in Salem. In 1978, Salem City adopted its first master plan. In 2014, the last major glass manufacturer in Salem City shut down, which happened to be the same spot where the second one opened up. And in 2025, Salem City began the redevelopment process for its master plan. For those who haven't visited Salem, here is a quick photo walkthrough of the city. It is a small but mighty municipality at just over 2.3 square miles, right along the Delaware River. Some of my personal favorite highlights include the charming red brick downtown you could see us wandering through, a lovely farm, and an outdoor amphitheater. Moving to land use and zoning aspects, Salem's compact size is complemented with a diverse mix of uses. Residential areas sit close to the economic core, promoting walkability and supporting local businesses. And this map highlights the strategic placement of the manufacturing usage right along the waterfront, providing Salem the unique opportunity to engage in maritime industries such as ports. Salem City is home to over 5,300 residents, predominantly female and with a majority population. It's one of the lowest earning municipalities in Salem County with a median household income of just over $38,700, with nearly a quarter of the residents living below the poverty line. On the health side, 2/3 of the census tract in Salem City have between 33 and 38% of their adult population identifying as disabled, which is notably higher than the county average. Salem also shows a significantly higher share of residents reporting fair or poor overall health compared to the surrounding municipalities, ranging from 24% to 29% census tract, which is at least 3% and at most 18% higher from the surrounding municipalities in the county. So this slide visualizes health indicators for Salem City taken from the City Health Dashboard. Salem falls below average in broadband connection, high school completion, and health insurance, while being higher than average in diabetes rates, frequent mental distress, high blood pressure, food insecurity, rent burden, and lead exposure risks. It is worth noting that our team reviewed 33 Salem County planning reports and documents and 13 Salem City specific planning documents and reports. This timeline highlights just a few of our most referenced reports throughout our project. And with that, I would like to hand it off to Ladarion to kick off our major findings.
Thank you, Nicole. In the next segment of this presentation, we will cover Salem's strengths, challenges, and opportunities as they relate to the following areas. I will start with environmental health. Environmental health is a fundamental determinant of public health as it shapes both immediate and long-term health outcomes. The condition of air, water, land, and ecological systems directly influences rates of chronic disease, life expectancy, and overall well-being. Access to clean air and water is associated with a number of physical and mental benefits, while exposure to pollution and contamination is closely linked to the prevalence of cardiopulmonary diseases, asthma, cancer, delayed childhood development, and even premature death. Given the magnifying ramifications of anthropogenic climate change, the need to consider environmental health will only become more pronounced as the challenges like sea level rise, extreme weather patterns, and global warming continue to threaten communities around the globe. Salem has several strengths as it pertains to environmental health, namely its sanitary sewer system. Another key asset, the sanitary sewer system, separates raw sewage and stormwater into different pipes, reducing exposure to hazardous waste materials during flooding events, thus protecting both public health and local waterways. In addition to brownfields and limited park access, Salem faces significant environmental health challenges in the form of flooding. The municipality's situation along a low-lying coastal wetland contributes to this elevated risk. Flooding is New Jersey's most common natural disaster, and since 1958, the frequency of heavy precipitation events has increased by 71%. This is especially concerning for Salem, where approximately 80% of all of its urban land cover is susceptible to flooding, due in part to high concentrations of impervious surfaces and low urban vegetative cover. This map here showcases the buffer analysis representing residential proximities to brownfield development areas and known contaminated sites. Almost half of all homes within Salem are within a quarter mile of one of these sites. Some of these locations have been found to contain toxins such as benzene, PCBs, PFAS, heavy metals, and other hazardous compounds. Many of Salem's most pressing environmental challenges can be addressed through enhanced urban greening. Expanding tree canopy cover and green spaces, especially along the waterfront, can simultaneously assist in managing air quality, urban heat, flood risk, and stormwater runoff. Given Salem's high impervious cover, aging water infrastructure, and limited green space access, this represents one of the most impactful opportunities available for the city to pursue. With that, Ada Elwell will present the next section, mobility and transportation.
Thank you, Ladarion. Sorry, I didn't realize. I'll just use these, sorry. So mobility and transportation affect health in three primary ways: access to healthcare, pollution from transportation vehicles, and health risks associated with sedentary, low-activity lifestyles. Currently, Salem has a few notable transportation strengths. As you can see here, the city currently has 2 bus stops. The existing service, while limited, provides a critical baseline regional connectivity. With roughly 1.5-hour wait times and only 2 lines serving the city, it's far from ideal, but its existence remains vital for the people who use it. Another is the city's naturally high density, with over 7,400 daily trips generated by residents, in-city jobs, and students across just 2.3 square miles, making Salem well suited for walkable and active transportation. And as a result of its historic density, Salem benefits from an extensive sidewalk network covering most of its streets. Towards the core of the city, there are just a few gaps in the network, with the primary obstacles being uneven paths, overgrowth, and the few areas that don't have sidewalks at all. The more relevant details of Salem's transportation and mobility are the challenges that significantly affect residents' ability to access healthcare and maintain an active lifestyle. The city's isolation is a major concern. Reaching Camden by bus takes approximately 1.5 hours, and missing a bus means waiting just as long for the next one. This is especially serious given that 30% of households lack access to personal vehicles, and local estimates suggest that that figure may exceed 50% total. With no designated bike lanes or micromobility infrastructure, walking is the only alternative to driving. This limits both healthcare access and recreational activity, as heavy vehicle traffic discourages pedestrian use of streets through noise, pollution, and physical danger, reducing opportunities for the recreational activity that is essential to good health. There are several opportunities to improve mobility and transportation in Salem. The existing rail line has potential for reactivation. As currently planned, transitioning freight from trucking to rail would reduce pollution, and rail-to-trail conversion offers added recreational benefits. While a passenger station is unlikely in the near term, the Salem branch's direct connection to Camden makes it a long-term opportunity worth keeping on the table. A significant opportunity for healthcare improvement would be the coordination and expansion of existing paratransit services. Currently, Scoot and the South Jersey Family Medical Center are the only service providers in the city. So pooling of resources and knowledge could serve to expand the capacity of both organizations. From there, coverage of the residents of Salem can be gradually expanded to those that need it. And lastly, a new bike network could meaningfully transform mobility in Salem. The city's natural density means that many destinations are only a street or two apart, making a connected network of bike lanes highly feasible and impactful for both daily trips and overall activity. And there are multiple grant programs like Safe Routes to Schools, Safe Routes to Transit, and state bike lane grants, and more that could be tapped. And next, Brendan Bermingham will present healthy food access.
Thank you, Ada. So, as you all know, access to healthy food and quality nutrition is a critical determinant of public health. The diet plays a key role in overall health outcomes, and without adequate access, residents face higher risks of chronic illnesses such as diabetes and cardiovascular disease, as well as having challenging mental health impacts. Salem has several key strengths when it comes to healthy food and agriculture. The city is surrounded by productive and preserved farmland, which creates real opportunities to connect residents to local food. And community interest is very strong, with over 72% of residents expressing a desire for improved local food initiatives, according to the Salem Community Choice Survey. Another key strength is the incoming new grocery store sponsored by Ranch Hope. It'll be centrally located in Fenwick Plaza, which will bring a wider range of fresh and healthy options to residents. Finally, Salem benefits from strong planning designations that, while they are reflective of real challenges in the community, they open the door to assistance programs and grant funding opportunities. Salem faces significant challenges in food access and nutritional security. According to the City Health Dashboard, 36.1% of adults report not having access to enough food or the financial means to obtain more. This is compared to a national rate of 17.8%. Financially, about 75% of households fall under ALICE conditions, which stands for Asset Limited, Income Constrained, and Employed, meaning that they earn too much to qualify for programs like SNAP and WIC, but not enough to meet their basic needs, which puts them in a difficult gray area. Physical access is equally limited. Salem currently has no full-service grocery store within city limits, leaving many residents reliant on the local Family Dollar, corner stores like the 49 Deli, and gas station mini markets as their only walkable options. Transportation compounds this problem further. The nearest full-service grocery stores are beyond a 10 to 15-minute drive, and roughly 30% of Salem residents lack access to a personal vehicle, which puts a large share of residents outside of reliable food access. And now there are many exciting opportunities to strengthen food access and agriculture in Salem. Vacant properties could be repurposed for urban agriculture and food retail, such as community food co-ops where residents can invest in and benefit from a locally owned grocery store, or even a food co-pack facility that expands access while creating jobs. There is strong potential to better connect the region's agricultural production with the local need through farmers markets, mobile markets, and community-supported agriculture. Finally, GIS analysis can help target these efforts by identifying where initiatives like mobile market routes and new community garden locations might have the greatest impact. Now, Mercy will discuss healthcare access in Salem.
Access to healthcare is one of the most fundamental determinants of community health, as it shapes population ability to prevent, manage, and treat illnesses. Without reliable access, even treatable conditions can escalate into serious health crises, affecting low incomes and undeserved communities like Salem City. For the strength of Salem City, the basic strength in Salem City is the availability of existing health facilities, which is the Southern Jersey Medical Centers, as seen on the slide. Existing healthcare facilities are assets to the community as they provide a foundation for care. The Southern Jersey Medical Center in Salem City provides vital medical services and referrals and has potentials to be expanded upon to better meet growing community needs and improve health assets. Salem City faced several health and challenges in terms of health access, one of which is Salem City faced several interconnected healthcare access challenges. Physically, only 3.29% of the city land area falls within a quarter-mile walk of medical care location, meaning the vast majority of the residents cannot reach care on foot. They depend on transportation. While there is a hospital just outside of the city boundaries in Mornington, many residents have difficulty accessing this facility due to transportation limitations. Physically, accessibility issues are further compounded by limited public transit, and roughly 30% of the household lack a personal vehicle, leaving many residents with no reliable way to get to provider. Beyond access, Salem City holds a health professional shortage area designations, reflecting a significant gap in primary care, dental, and mental health providers. Underlining all of this is a history of structural disinvestment that continues to shape both the health of residents and their ability to access care. In terms of the opportunities, Salem City has several opportunities. Despite all these challenges, Salem City has meaningful opportunities to improve healthcare access within the city. The city health professional shortage area designations, while reflecting a real gap, also makes Salem City eligible for federal fundings and loan repayment programs that can attract new providers. Similarly, the health enterprise zone designations offer financial incentives and tax benefits, specially designed to draw healthcare professionals to undeserved area like Salem City. Existing facilities like the Southern Jersey Medical Family Center and Inspira provide a foundation that can be expanded, better staffed, and more equitably distributed rather than built from scratch. Salem City will benefit from a community health access study model after Trenton City, providing a municipality-specific analysis distinct from the broader county level assessment. Finally, Salem Community Network, particularly churches and community centers, are trusted spaces that already support outreach. As one resident puts, and I quote, "Their church feels like a safe space. That trust is a powerful asset for connecting residents to care." With that, I will hand over to Maheen to present the housing session.
So housing influences physical and mental well-being through stability, quality, affordability, and inadequate housing is directly linked to chronic illness, respiratory diseases, and mental health struggles. This map highlights some of Salem's inclusionary housing areas. The Salem Housing Authority manages 180 public units, and recent inclusionary zoning initiatives have created additional opportunities by requiring new developments to have a percentage of affordable units and privately developed affordable home ownership options. So 3 major strengths of Salem is first their 2023 housing strategy. Many distressed municipalities actually lack this, so it goes beyond identifying problems and it actually lays down a roadmap for things like home ownership support, rental quality improvement, and neighborhood revitalization. This is a meaningful asset because funders and state agencies really look for documented planning work before they decide to invest, and Salem has done that work. Then their environmental justice designation provides legal protections and funding access across NJDEP, NJDCA, and NJ Green Acres. For a small city with limited local revenue, having this is a powerful tool that allows Salem to address their housing conditions without solely relying on its own budget. And then third, they have a solid foundation of subsidized housing with 44% of their residents living in poverty and 66% of renters cost burdened. Having over half of all their rental units subsidized means that even the most vulnerable populations aren't without options. And there's a utilities included model at Westside Court, which is especially significant because it removes the burden of separate utility costs, and that can be the difference between housing stability and crisis. As for challenges, first, Salem has an aging housing stock. As you could see, a lot of their units were built before 1960 when lead paint was standard practice. It's actually 69% of their housing was built before 1960, and Salem City and Penns Grove have the highest rates of child lead poisoning in Salem County, and low-income residents have very little protection beyond the free county screening programs. Second, they're severely cost burdened. 57% of Salem's households spend more than 30% of their income on housing. With the median household income of just $40,000, there's almost no financial buffer for emergencies. And the Alice population that Brendan talked about falls into a critical gap as well. They're also missing housing types and their zoning gaps. Their zoning code has no provision for accessory dwelling units, assisted living, veteran housing, or emergency shelter. With home ownership down 9% since 2000, and only 3% of their housing units were built in the past 20 years, there isn't really a realistic path forward if there isn't zoning changes. Their vacancy and safety concerns, there's a 26% residential vacancy rate in Salem, and community responses consistently linked feelings of safety to the concentration of vacant and abandoned properties. For residents, blight isn't just a abstract planning term, but it's actually something they live next to every single day. And finally, there's tenant fear of retaliation, where a lot of tenants frequently don't report housing code violations out of fear of eviction or landlord retaliation. So the true extent of the housing conditions are probably far worse than the official data captures. Moving on to opportunities, their 2026 master plan update is a huge opportunity as it gives Salem a chance to formally adopt housing tools it currently lacks, like their climate change and hazard vulnerability assessment, which would identify climate risks and vulnerable residents. Through the NJDEP Resilient NJ program, Salem qualifies for funded technical assistance with little cost, with no cost to the city. West Side Court is their single-handedly biggest housing opportunity. It's able to address affordable units, accessible design, and supportive housing all in one project. So the city's in its second year of planning, and its opportunity zone status makes it attractive to private developers who can help fund the redevelopment. And third, adopting an ADU ordinance and inclusionary zoning would meaningfully expand housing options. New Jersey is already moving towards requiring ADUs statewide, so acting now allows Salem to set its own local standards before state mandates. And pairing ADUs with inclusionary zoning ensures that new developments automatically contribute affordable units to address the city's housing shortage. Now I'll invite Brandon to present the next section.
So much, Maheen. So community and economic development is a extremely broad category that intersects a lot with some of the challenges already discussed, and for good reason, because a weak local economy makes it hard for a municipality to fund services, maintain infrastructure, and invest in itself. And this has a direct impact on the health of the residents within that community. One of Salem's major assets is its deepwater port. Although the port activity is limited to 2 shipments a week, its status as a free trade zone and a port of entry makes it viable for expanded use, which would create a lot of jobs and broader economic activity. An unused rail spur connects it to the larger regional network, making it increasingly viable for expanded opportunity. Another strength is the Salem County Workforce Development Office, which helps residents with things like resume building and job searches. Despite this, Salem still has some significant challenges. Its local economy is still stagnant and suffers from a lack of job opportunities, compounded by its isolated location. Education is another concern. The high school shows some signs of possible roof damage, as well as harmful substances such as asbestos and mold. Additionally, there is no secondary education. I just realized I'm not standing here. There is no secondary education included in the city, which basically makes it inaccessible for any residents without a car. Salem also contends with a negative perception of the city, and this makes a roadblock for investment for new residents and new businesses to invest in the city. While crime has been decreasing in recent years, many residents still feel that there are some safety concerns. Still, Salem has some real opportunities, and to build on these assets, its historic architecture, compact walkable layout, creates strong potential for mixed-use development and community revitalization. Also, its position as the county seat means that county services are available within the city, and it opens up an avenue for more collaboration between the city itself and county on key issues, the county government on key issues. Next, I'm going to invite Ladarion back up to bring us to the recommendation section.
Thank you, Brandon. Our recommendations span a plethora of programs, projects, and policies across each focus area, with detailed implementation strategies included in our final report. Here, we'll highlight key recommendations from each section. For environmental health and sustainability, a few recommendations include expanding green stormwater infrastructure, staffing the Shade Tree Advisory Board, and expanding park access. I will be speaking in depth on the final item. While Salem technically has 3 parks, they largely cater to children and cover relatively little area. Repurposing vacant lots and underutilized land for park development with features serving broader demographics would meaningfully improve access. This matters because proximity to green space is associated with significant health benefits, including increased life expectancy and reduced air pollution. Given Salem's elevated rates of depression, loneliness, obesity, and heart disease, expanding green space accessibility is a critical lever for improving overall public health. The New Jersey Department of Environmental Protection has a number of potential funding opportunities, such as the Green Acres Program. Local partnerships with organizations like Revive South Jersey and Stand Up for Salem can further assist in bolstering these efforts.
For mobility and transportation, we have 3 sample recommendations. First, complete street ordinances, which is to establish non-car modes as equal in priority and legality, enabling a wide range of public and private improvements. For example, zoning codes could be amended to allow bike parking and connecting lanes to satisfy automotive parking requirements, making car-centric standards fungible with biking alternatives. Second, development of a local bike network with supporting fixtures such as parking, locks, and repair stands to encourage active transportation, reduce car pollution, and increase physical activity. Installing bike carriers on buses and shuttles would further enable seamless transfers without requiring riders to return to personal vehicles. Though often perceived as expensive, pilot plastic laydowns and context-specific designs offer cost-effective approaches for creating bike networks. And third, improved paratransit coordination. Coordinating across agencies would reduce duplication and expand coverage, while shared pickup sites designated for comfort would improve the experience for vulnerable riders, particularly those traveling to medical appointments. Connecting the South Jersey Medical Transportation Facility to a safe walk and bike network would allow residents without vehicles to access the site independently.
So there are several promising ways that grant funding can quickly improve food access in Salem, including the development of mobile market routes and the development of a prescription produce program. But the project that we believe is the most feasible would be expanding cold storage in existing retail sites. By providing grant-funded refrigerators and freezers to local stores, we allow them to stock more fresh produce, dairy, and other perishable items like meat and fish. And by building on places where residents already shop, this approach brings healthy options directly into the community. Funding is available for these types of programs through the USDA's Healthy Food Financing Initiative, and similar efforts have been successfully implemented by the Food Trust, which is a Philadelphia-based nonprofit. Partnering with organizations like the Food Trust and also Ranch Hope or Stand Up for Salem, for example, would help ensure successful implementation of projects like these.
For the healthcare access in Salem City, we came up with several recommendations, one of which is first, healthcare workforce and faculty initiative. Salem City needs more providers, and this initiative will focus on recruiting, training, and retaining local healthcare workers to build a stronger, more sustainable care infrastructure within the city. Secondly, mobile health services expansion. Expanding the operating hours of existing mobile health services will directly address the barrier faced by residents who cannot easily travel to provider, bringing care to the community rather than encouraging the community to come to care. Thirdly, a telehealth access and digital equity program, which is expanding virtual healthcare services alone is not enough. If residents lack internet access or digital literacy, this recommendation pairs with telehealth expansion with free public internet access in places like the library and digital skills supports, ensuring residents can actually connect to and benefit from virtual care.
So for housing, first, the housing and land use flexibility policy would allow accessory dwelling units by right and expand housing options, helping residents age in place. It would also require new residential developments of 5 or more units to make at least 15% of units affordable to households earning 60% or below the area median income. Second would be the first-time home buyer assistance program, which would allow a forgivable down payment and closing cost assistance for buyers who remain in a home for at least 5 years. This would help a lot for a city where 2/3 of residents are renters. And then lastly, the rental rehabilitation and housing program, where, oh, I did that so wrong. I'm so sorry. Okay. Wait, I went over that. Sorry. The last one would be the landlord rental rehabilitation and loan program, where you'd offer low interest or deferred loans to small landlords for significant repairs, such as structural fixes, HVAC replacement, and mold remediation in exchange to keeping rent affordable.
So some recommendations for community and economic development. First, the rehabilitation of the abandoned Campbell Center or the construction of a new recreation center to provide residents with a safe, welcoming, and public recreation center for all residents, especially children and seniors. Next would be the Department of Community Development should compile and maintain a updated resource guide for small businesses. This would be a cohesive, accessible guide to state and federal programs, which would be a meaningful support tool. And it would include things like the Small Business Lease Grant, the Small Business Improvement Grant, and information on Salem's status as a federal opportunity zone, which could bring in further outside resources and support local business development. Third, Salem should consider adopting a community-oriented police model following the example of nearby Camden. This approach has been credited with helping reduce violent crime and improve overall conditions. This model focuses on rebuilding trust between residents and law enforcement through an intervention program for at-risk youth, as well as addressing some of the root causes of crime, like isolation and a lack of opportunity. This is all while increasing officer visibility on foot and by bike. With that, I will ask Shreya to conclude our presentation.
Over the course of this project, we identified assets, gaps, and opportunities within Salem's existing spatial structures as they relate to public health using both quantitative and qualitative methods. This allowed us to develop a range of empirical, actionable recommendations addressing public health through planning interventions tailored to Salem City. Our primary limitation was time. With a 14-week semester, a topic as robust as this one would have benefited from a longer timeline, allowing for more in-depth analysis and additional field research. That said, we made the most of the time we had. While this presentation marks the end of our studio, the work is far from over. We will be publishing 2 blog posts in South Jersey Climate News in collaboration with Community Planning and Visualization Lab, and all project outputs will be made publicly available on the lab's website. This presentation will also be accessible for viewing on our YouTube channel, linked through the same site. We will also provide a memo to the AP-NJ Plan for Health team detailing our experience implementing the Plan for Health tools at the municipal level with the goal of shaping future approaches to similar projects. Most significantly, we will support Salem City's master plan revision by providing all data, analysis, and outputs to the NJ Department of Community Affairs as they work to finalize the health element for incorporation into Salem City's updated master plan. Thank you all for your time today. We are now happy to take questions. For those joining us Zoom, please feel free to use the chat function to submit your questions.